Hello, thank you for tuning in tonight. My name is Brittany and I'm from the Chicago Abortion Fund and I've had an abortion. We haven't been here in the past 2 months. We're here tonight. It's not the last Wednesday of the month due to the holiday next week. So going forward next year, it will still be the last Wednesday of the month. Like I mentioned, I'm from Chicago Abortion Fund, and what we do is provide financial assistance to women who are seeking second trimester abortion services. We also have an outreach component. That means we go out into our communities, distribute information regarding reproductive health and reproductive justice. We also have this TV show, which we use as an outlet to kind of destigmatize abortion. That's why in the past we've had women come on who are willing to say that they've had an abortion, say that at the start of the show, just so that, we destigmatize abortion every chance we can. We also have our forums. I'll talk more about that a little bit later. We conducted one at Robeson High School last month and in October, and that led to a very interesting discussion and also the topic for tonight. Like I said, we do help women pay for their second trimester abortion services. We chose to fund women in their second trimester because a lot of clinics and pro-choice advocates and abortion advocates, there's a lot of funding for women who seek first trimester procedures. And oftentimes, when women find out that they are pregnant and they choose to terminate a pregnancy, they're in their first trimester, but if they are of low income or they are unemployed, they have to then come up with ways to fund their procedure. So if they're part-time or they don't have any employment at all, they maybe have to borrow it from relatives and friends. So while all of this is happening, time is passing, weeks are passing, and once you are past your first trimester, the procedure goes up. Not every week, but the further you are, the procedure cost does go up, regardless if you're in the very beginning stages of your second trimester or if you're seeking a late-term procedure. I'm going to go ahead and show you our overhead information and how you can contact us. As you can see, our address is 333 West North Avenue, Suite 267. That's in Chicago, zip code 60610. And if you are in need of funding or you know someone who would like to utilize our services, this is our client line at 312-663-0338. You can also reach us directly if you have just any questions, comments, or concerns about our services or would like to learn more. You can call us directly at 312-663-0336. Our website is www.chicagoabortionfund.com, or you can send us an email at info@chicagoabortionfund.com. I just wanted to, since I've given you our web address, I'd like to just show you what our website looks like. And you see it's www.chicagoabortionfund.com. Sometimes if you Google search us, .org pops up, but it will still direct you to this website. There's our mission and vision, staff and board if you'd like to learn more about our statement of values, frequently asked questions. There's always a report on here from our executive director, different remarks from allies, partners, board members. We do have an advocacy tab on here if you'd like to learn more about that. I mentioned it briefly at the start of the show. We also have a photo gallery. We have tons of pictures from our previous outreach efforts and different functions we've been going to, and that I've been going to, especially since about 2007. And additional resources, how to become an advocate, how to donate, and our videos. If we click that tab, it's going to take you to our previous shows that we've been doing for a few years now. And we also have a blog, and that's with blogger.com. But like I said, if you click on all of these tabs, you will be redirected to everything that it mentions. Before I go further, I'd just like to encourage you to please call in. This is a live show, and we encourage your calls, comments, questions. Please give us a call at the number at the bottom of the screen, 312-738-1060. I've talked about parental notification the past couple of shows. I cannot stress it enough because we do have minors and young adults calling us now who are seeking funding and they're under age 18, and this directly affects them. It affects our youth. Parental notification means that an adult family member has to be notified by your abortion provider before your procedure can be done. If you choose not to notify an adult family member for whatever reason, you don't feel safe going to that adult family member, you don't have an adult family member to go to, you can contact the ACLU of Illinois. That stands for American Civil Liberties Union of Illinois. And they have an entire program called the Illinois Judicial Bypass Project that's dedicated to helping youth who are seeking abortion services. I will go ahead and show you their information. And there is a separate website link that you can go to, but just since I always use the acronyms ACLU, I decided to just take you through this process. And then once we click on a different tab, you'll see where the website changes. But right here in the bottom right hand side, it says Illinois Judicial Bypass Coordination Project. And if you click on that, everything pops up. There's a toll-free number where there's a free 877 number you can call. You can also text them. I've given out these numbers before. The text is 312-560-6607. I know we're in the age of technology and you may want to text, but there's just a lot of options on here. And if you click on these, it pulls them up. I'm pregnant, what do I do? And then there's options that pop up. You know, you can either choose a parent, you can adopt, or you can seek abortion services. And if you choose abortion, I mean, they will walk you through that process. And the 877 number is 877-442-9727. Just wanted to let you see what that looks like. So again, you'll go to the ACLU of Illinois website, go to the bottom right-hand corner, and click on their Judicial Bypass Project. And it's going to be this photo here. And also in the past I've shown you their pamphlets and their postcards. They look exactly like the photo that's on their website. They can send these out to you if you need some of these to distribute to some youth who may need this information. Or you can contact us and we can get that out to you as well. We have these as well. But I just kind of want to make sure you see what the website looks like and see that it's not hard to go to if you need that information firsthand. I talked at the beginning of the show about our educational forums. And last month and in October we went to Robeson High School. We've been going there for a couple of years through another ally organization who invite us in to talk to some of their young women who participate in an after-school program. We've been doing that for several years now, and I can remember since I've been affiliated with CAF, a few years ago there was a statistic out saying that Robeson had one of the highest rates for teen pregnancy and teen parents. So it's very important that we get all of the information out there, not just regarding abortion. We go in there and we discuss a myriad of topics, especially birth control and STD and STI prevention. But we were asked to specifically talk about their options and abortion, because there's a lot of misinformation out there. And just from that lively discussion, we heard a lot of the misinformation. Some of the students were really against abortion. Some were strong supporters of it. Some had horror stories from their parents and friends and family giving them misinformation and wrong information, inaccurate information, as a scare tactic. Regardless to what a woman chooses, we support her, but we also give you all of the information. There have been women who've come through our program and joined the leadership group who have become parents since being in the leadership group. Some are already mothers, some are mothers coming into the program. So we're pro-choice, and that means that we do support a woman's choice. But from that discussion, some of the young women just didn't know what abortion entails. They thought it was this unsafe procedure. They thought that it was I hate to say some of the things they were saying, but let's just say they had a lot of misinformation. So one of the things I wanted to really talk about with the young women and tonight was just try to break down what I've learned, and this is through doing my own research and talking to healthcare officials and people in the medical field about what abortion is and some of the risks or some of the risks they like to link up with abortion, which have been proven inaccurate. I'll get to that later. So there are two types of abortion that we talked about, and that was the medical abortion, which is the abortion pill, and that you can take the abortion pill up to 9 weeks. From 10 weeks, they start the surgical procedure, and at some places they only go up to first trimester, and first trimester is about 13 weeks. But starting at 10 weeks, you will have the surgical procedure and not the pill. We talked a lot about where you can receive these services. If you Google abortion clinics in Chicago, several clinics will pop up. They also offer abortion services at Cook County Stroger Hospital. They are $75 for medical or surgical procedures. They only service women up until about 12, 13 weeks. From then, you will have to contact another clinic, and then you will go from there. But like I said, they do offer both of those procedures, both for $75, regardless of what health insurance you have. So that's an option. Like I said, if you want, we're not making referrals, or we're not going to recommend any particular clinic. We work with several in the city. So again, you will do your own research, and you will call these clinics or research them, and then schedule you an appointment if you're past the Cook County restrictions, or if you choose not to go to Cook County. Still do your own research. A lot of times people are questioning the safety of abortion, and I understand that. Most recently there was something in Philadelphia. There was an abortion provider who was doing a lot of illegal activities regarding abortion services. And that is why we need to make sure that we're doing everything we can to make sure that women have access to safe and affordable procedures. Because when women feel like their backs are against the wall and they have no other resources and they can't reach out to anyone else, they will go to those who are willing to do illegal activities just to make a dollar. So that is not the case with all abortion providers. This was a guy who chose to do something illegal, and that's the result of that. But again, that just reinforces the need for women to have access to safe medical and surgical abortions. I want to show our overhead once again, just so you know. You can call us directly at 312-663-0336. That's our direct line. The number that is listed here that ends in 0338 is for our client line. If you know of anyone who is seeking financial assistance, please refer them to us. We would love to talk with them and see how we can help. If you want to send us a correspondence via mail, our mailing address is 333 West North Avenue, Suite 267. The zip code is 60610. I've showed you our website earlier tonight, but here it is again. It's www.chicagoabortionfund.com. And please feel free to send us an email if you're comfortable with that. It's info@chicagoabortionfund.com. Again, we're talking about the safety of abortions. And I pulled some of this information from Guttmacher Institute. You can research them. That's Guttmacher Institute. And they have a lot of statistics regarding people's health. And if you type in keyword abortion, then a lot of stuff will pop up. And they have all of the references to back up all the information that's on there. But again, do your own research. Some of the risks people talk about, such as infertility, a miscarriage, or birth defect, there have been no proven, these first-time abortions that I was speaking about up to 13 weeks, they don't pose any long-term risks, such as those I mentioned. And a lot of the young women I've spoken with, and not just at Robeson, even when we were out on the street conducting our community outreach, walking in neighborhoods, asking people what do they know about abortion, these are some of the responses. So again, do your own research. It's all online. I know it could be a bit much, but try to use like a trusted site, because a lot of times things are they're disguised as pro-choice websites, and they're really not. So if you can find something that's probably provided through like the state or government, or just someone that you know are trustworthy, please, I encourage you to research them. I've talked about this on a previous show, I don't know when, but there's sometimes this association with breast cancer and abortion that has not been proven by anyone. They've actually made their case to where there is no association between the two, but that is something that people often throw out there. Another big misconception is that abortion is linked to a lot of women's mental health issues. That is not to say that women won't. I mean, we're all going to feel a different way when we have our procedure. I can't say that someone is going to feel how I felt, and I don't expect anyone to say that they felt, you know, how another woman felt. However, there's no medically proven information to link those to that. And we also, in our post-abortion package, we send out some information for women who have had an abortion and they now feel like they want to reach out and speak with someone. We do have resources for that. So if you know of a woman who's had an abortion and would like to speak with someone, we do have resources for her. So please give us a call at the 312-663-0336 phone number, and we can definitely get that information to her. Another stat that I got off the website is that 58% of abortion patients say they would have liked to have had their abortion earlier. This goes back to the statement I made about us funding second trimester, and I went through all the reasoning behind that. Women make that decision. Some women make that decision well before they actually can have their procedure done. I was one of them. Several of my associates as well. They were brave enough to share their experience with me. So I personally know that I made my decision when I was in my first trimester, but I could not raise enough money. I couldn't borrow enough money to come up with I think it was like around $400 then. So I was essentially forced to wait until I was in my second trimester. So women make that decision a lot sooner than they can actually act upon it, which is unfair. But I know that a lot of people make that statement of, well, why would they wait? They sometimes are forced to wait, and sometimes are forced to carry an unwanted pregnancy to term because they couldn't come up with the funds in the first or second trimester, which is very unfortunate. And this next stat goes back to what I just mentioned. Nearly 60% of women who've experienced a delay in obtaining an abortion cite the time it took to make arrangements and to raise money. So again, it's very time consuming. And think about women who are in the rural area. They don't have access to an abortion clinic. Sometimes there's only one in each state. They have to figure out, you know, child care if they have children, how they're going to pay for their travel expenses, lodging, missing time from work if they are in work, missing time from school if they're in school. So a lot of time goes into that, and also figuring out how you're going to raise enough money. And these are all valid issues that women face. Now, to talk more about some of the laws and policy, I talk on each show just about, I try to give an update on some abortion bans or just what's going on in abortion news and how law and policy are, surely enough, restricting women from exercising their right. Once they've chosen to have an abortion, how can they access it? Because without access, there really is no choice because you're not accessing anything, right? So in '73, the Supreme Court ruled, with the Roe v. Wade ruling, that, you know, abortion is a right, and that women have the right to choose abortion, and that's up until when the fetus is viable outside of the womb. So that's usually around 24 weeks. I know in the state of Illinois, abortion is legal up until 24 weeks. 3 years later, the Hyde Amendment passed in Congress, and what that does is restricts federal funding from covering abortion services, with some exceptions when the woman's life is in danger. There's if it was rape or incest. There have been 17 states who have used state funding to pay for a poor woman's medical abortion and surgical abortion. However, 4 of those do it by choice, and the rest are court ordered. So you have 13, that are court ordered, even though the state has said, you know what, hey, we are going to help our Medicaid recipients pay for their abortion services. They still had to get a court order just to have that mandated. And also there are 35 states right now that either have the parental notification or the parental consent when minors are seeking abortion services. So I explained what notification was earlier, and that says, you know, they're being notified, which could essentially mean consent, because if there's this written document, this typed document that the adult family member would sign saying that they've received notice that that minor or that their youth is seeking abortion services. So I mean, doesn't that equate to consent? Because without that paper, the minor couldn't have the service anyway. Consent absolutely means that one of your parents have to consent, and in some of those states, both parents have to consent, whether there's a custodial parent, or they're absent, or they're not in their child's household or life. The both of them have to do that. If you go to the Guttmacher Institute's website, they have a breakdown of all of those states. They have a list of all 50 states, and if you read across, it tells you like if it's either notification or consent, if both parents need to consent. Like I said, the information is out there. I encourage you to look it up and get as much as you can. And just to talk a little bit more about the Hyde Amendment, we do a lot of work at the Chicago Abortion Fund trying to repeal the Hyde Amendment. We're constantly, in everything that we do, that is a huge part of our work, because it unfairly discriminates against poor women, low-income women, marginalized women who use Medicaid, or if there's someone who's a federal employee, if it's a male, that means that his wife can't use those services, his children that's on his insurance can't use it. If the woman herself is a federal employee, she can use it, and you know, it goes the same with her children, anyone else who's enrolled in her insurance plan. They can purchase it separately, and I've done some research here at the county level and in the city level, and some of the information I found is that some of the employees, because of course we're not one of those states who provide state funding, so of course you won't use it at any level lower than state, so city, county, no, there's no funds, no state funding for abortion services. And some of those, even with the insurance, is limited to those exceptions, which is life endangerment or rape or incest. I want to go ahead and show you our overhead one more time. If you'd like to reach out to us via email, go ahead and send us an email. That's the last one, at info@chicagoabortionfund.com. If you know of anyone who needs our services, please give us a call at the number listed, 312-663-0338. If you just want to get more information, go to our website. It's listed there. Or you can give us a call at 312-663-0336. That's our direct line. And like I mentioned earlier, we will be back next month on the very last Wednesday of the month at 8 p.m. I wish you a safe and happy holiday, and enjoy the rest of your night. Thanks for tuning in. Bye.